I'm Dr. Jeff Machat, Medical Director, Crystal Clear Vision Laser Center in Toronto, Canada. I've been performing refractive surgery for over 20 years, and Dr. Balazsi has been one of my very good friends. He's one of the medical directors in Montreal, Canada at the LaserView Clinic, world-renowned. They've done over 100,000 procedures. Once again, we are at the forefront of new technology, and today we're in Tokyo, Japan.
20 years ago was Istanbul.
Yes, that's right. 20 years ago was Istanbul. Isn't that incredible? And now we're at the forefront again of this new technology. Why don't you just, share with patients, both from a surgeon perspective and your own personal experience, what this technology has really been like for you?
Well, as you know, I was wearing reading glasses for almost 10 years, and it became a crutch for me. I just absolutely hated it. I hadn't worn any glasses till I was in the 40s, and all of a sudden this slowly crept on me, and I was really a miserable patient. And I looked around for various solutions, and all the other solutions out there, yes, they do make you see better up close, but you give up a price of not seeing as well in the distance. And that to me was the deciding point. I realized this is what I want. So I came to Tokyo last June, saw Dr. Tomita operating, and underwent the procedure myself, and it's been life-changing. I've not put on a pair of reading glasses since that time. I just feel I can do so many more things that, that dead zone.
Right.
Where you just, wear my glasses, or even in surgery to check the readings off the computer, I'd have to reach for my glasses and
look at the chart.
Everything.
So here's a quick question, because I'm sure every patient, including myself, really, really wants to know this. What was the procedure like? Did it hurt?
No.
No pain?
2 drops of freezing, a little bit of pressure on the eye when they're actually making the area. They make a little tiny pocket in your cornea and insert it in. It took him 2 to 3 minutes to do the whole thing. And
so it's just a few minutes. And the implant itself is very small. Like, I'm looking at your eyes, and I couldn't tell which eye you had it done. I mean, it looks invisible.
My left eye.
It's in your left eye.
It's only about 3 millimeters wide, so it's roughly the diameter of your pupil. Right. Very few people will say, when you talk to surgeons who've done a lot of these, people will say, I can notice it in your eye. And people, come up to me and ask them, which eye is it in, and they can't tell.
Right. So very, very hard to tell. That's really fascinating to me. And does your eye feel different?
No, not at all.
Not at all. No pain, nothing.
No, it took my post-operative drops, the first week fairly frequently, and I'm just tapering down in my last month of taking drops once a day.
And the first time that you could actually read something, what was that feeling like?
You cannot believe, but I was quite fast. Most people takes 2 or 3 days, but the very next morning, on my watch, the smallest numbers is not the big ones. It's like the number 14.
A little tiny date there, yes.
That's about 3 millimeters wide. I can still see it from here all the way down to here.
Wow.
So you get a range with this implant, because it's like the f-stop of a camera. It's a small little aperture which increases your depth of focus. Reading glasses can't do that.
Right.
Monovision contact lenses can't do that. So that was the crux for me, because even if I've had a monovision contact lens, I could function at a party socially, but I couldn't drive my car. I couldn't do surgery that way. Whereas everything's in 3D. It's perfect.
I can't tell you how personally happy I'm to hear all of this.
You're next.
Yeah, I am. Obviously, first Canadian surgeons, you and your partner, to have the procedure done. I went ahead and made sure I was the first Canadian surgeon to actually perform the procedure. Now I'm following in your footsteps, just like Istanbul all over again, leading with, scanning laser technology. Now we're leading with reading vision correction.
It's an exciting time.
It's very exciting, because I think it's really going to open up a whole new world for our patients. I mean, that's what I'm excited about. I mean, all my friends who even before didn't want to have LASIK are suddenly interested, because they can get rid of their distance prescription and preserve reading vision. you know, and they're excited about that because they were used to taking off their glasses and being able to read.
Correct.
And now they'll be able to see in the distance with no glasses and be able to see up close. And the far-sighted patients, you know, like yourself, are even going to do even better.
No, to me, it was a revelation because even my distance vision got better.
Right.
So that it was like a double whammy for me. I got better at distance and this huge benefit at near. So it changed my life.
Well, I'm excited, and you know, can't wait to see what 10 years from now brings for the two of us and where we'll be
we'll
meeting.
Still be at finding some other new thing. That's been our history, and we want to continue doing that.
Well, thank you so much, Gordon. A real pleasure.
And have fun in your surgery in 2 days.
I know. Thank you.